find is that if they participate over and over again, if they go back, they do find it helpful. Oftentimes that first group is the hardest. What also helps, Robin had mentioned, exercise, nutrition, self-nurturance. Take a bath. You know, read a great book. You had mentioned TVs. That's something that we talk a lot about, TV in the bedroom. Get rid of it if you can. Use your bedroom as a place to nurture yourself, read good books, be in a quiet place. It's really hard to go to sleep after you've watched CNN. It's really, really difficult. Try it. Try when you're driving to listen to the classical radio instead of listening to the news channel. Your experience of traffic, your experience of driving will be different. You know, today as I was driving, I was very thankful that I wasn't part of that Boston Heart Association doing their walk along the Charles River this morning. You know, that was a way that helped me cope with my stress and anxiety. Keep a journal. Writing is a wonderful tool to help manage stress. Become active participants by learning more about your cancer, its treatments, side effects, symptoms. You all are here. You're active participants in your care because you're here. There are other things that can help too. I'm a huge fan of acupuncture. I'm a huge fan of wellness services, and that's what I'm going to turn and talk a little bit about right now. Wellness and integrative medicine is something that's really taken off over the past number of years, and I think it's because people are realizing that these things can help you feel better. There's a need for them. There's a reason why they're here. We often in the old days, and there's been a whole sort of trajectory of why these things are becoming more and more accepted in healthcare systems. It's because we used to talk about them and think about them as alternative medicine, things that you would do instead of conventional care. You know, we heard about Laetrile and other types of things that people go and get, that there was a lot of bad press about that because people were doing them instead of their conventional treatment. Lately, what people are talking more about is complementary medicine, things that you can do together with your conventional medical care. And more of what we're talking about these days is taking the best of complementary medicine, things that are well studied and well defined, and now fully incorporating them into your conventional care. And that's why you see at places like the Farber at Mass General, these practitioners are practicing side by side. Why are people using them? They're using them to feel better, to improve your overall quality of life and well-being. It's a great strategy for easing depression and anxiety, for managing symptoms and side effects. And I'll show you a slide about why people are using acupuncture and massage, for example, at our setting, to gain a sense of control. You know, this is something very readily available to you that you can do to help yourselves feel better. It's a wonderful way to help manage stress. And that's a big part of living with illness, is trying to manage the stress associated with it. So at Mass General, just recently, for the past few years, we have an acupuncture and massage clinic for our cancer center. These are some of the reasons why patients are coming to that center. The reason people are coming is really around these quality of life symptoms, but then also around some very specific symptoms, like helping to manage fatigue, helping to manage pain. But you can see also stress management and just feeling better. We have, for the patients from our GI Cancer Center who came to this clinic, over 50% of them came for the primary reason just to help them feel better. When you feel better, it's a lot easier to play with your children at night. When you feel better, it's a lot easier to be able to get up and go to work. It's a lot easier to be able to come in for your treatment when you're overall feeling better. There are a number of different types of complementary and integrative medicine. The ones that are bolded are the ones that we offer at Mass General. There are many of these that are now offered in hospital settings, but they're also offered in the community settings. We have acupuncture, yoga. I saw that you're going to try a yoga exercise later on this afternoon, which is fantastic. Gentle yoga is very different than what you think about yoga in terms of the contortions and the stretching. It's really about stress management, spirituality, meditation. We have art and music therapy, and massage. A couple of things just to comment, we do acupuncture in our infusion unit as well as in a traditional clinic setting. So while people are getting chemotherapy, we're also doing acupuncture massage. This is Qigong. This is in the Healing Garden where many of you were last night. Again, Qigong is a Chinese form of medicine, which is, again, combines meditative movements with gentle strength training. use these? You know, in the year 2000, there was a study that was done that said almost 70% of the general cancer population are using some form of complementary medicine. I would think that it's got to be a little bit more now, given what we see at our setting and sort of how you hear more and more about it in the community. The problem with it is not many insurers cover it. And this is what makes it really difficult, because here's something that helps you feel better, but many insurances still don't cover it. As we sort of think about healthcare reform and they start talking about more of a focus on wellness, our hope is that there will be more coverage for these types of programs. But what a lot of insurance companies do instead is offer discounts, so you can check with your insurance company. They may have a 20 to 25% discount as long as you use an acupuncturist that's part of their network. Same with massage. Or you can use your flexible savings accounts. You may have them at work, which you can use those towards, you can put the cost of these towards those flexible savings accounts. This is something we always get asked, how do you find a practitioner? You have to be really careful, because as you know, looking on the web, there's a lot of people who say that they do this really well, but they don't have the expertise around cancer care that we would really like people to have when they're practitioners. So the nice thing in Massachusetts, for example, is acupuncturists and massage therapists are licensed by the state. So number one, they have to be state licensed. That's an easy thing to be able to ask. You can also ask whether you can look to national organizations. If somebody's a member of a national organization, you can then try to see if through that organization, if there are members in your community. You can ask people, ask the acupuncturist, have you ever worked with people with cancer? Do you have advanced training in this? You will find some people who do have advanced training. They're the ones you want to go to. And then are they interested in learning more? They're all required by law to maintain a certain number of hours of continuing education. So you want to ask them, do they have continuing education to keep up their license? There are other resources, and I don't like to include resources on a slide presentation like this because most people then have to write them down and copy them, but it was great that you guys gave that slide to people as part of your packets. There are a lot of great websites out there. There are a lot of not so great websites out there. These are some fabulous websites. Another place to start at the massgeneral.org cancer, I put hopes, but also then to go to the Cancer Resource Room, because they have a Learn About section where they link you to lots of reputable websites as well. So I would urge you to go to that website to get more information. Some of these organizations talk mostly about wellness services, like I just mentioned. Others also talk about general coping. In particular, the Integrative Oncology one is a great website because it gives you an idea. If you're interested in getting a massage as somebody with carcinoid, I would go to that website and look and see what they say about massage therapy. For example, they recommend that you don't get a real deep tissue massage for somebody living with cancer. So you want to make sure that the massage therapist you go to knows that. But these are some fabulous resources. I include this because I think that it's about people's stories, and coping is about your own story, and being able to integrate these types of services into your care will help you feel better and will help you cope. I think this was a woman who was treated at Mass General for breast cancer, and she really talked about how by using acupuncture and massage along with her radiation treatment, it really helped her feel better. And continuing on with this, she said, when one suddenly enters the frenetic and turbulent system of a cancer diagnosis and cancer treatment and becomes a patient at an outstanding but a very large hospital, it's tremendously comforting and healing to have access to supportive complementary care. Their care will remain with me, as always, as one of the most nurturing aspects of my MGH experience. I think, another quote that I often use when I do these presentations is this one, because I think Lena Horne gets it right when she talks about not only an illness experience, but just life in general, that it's not the load that breaks you down, it's the way that you carry it. And I think that's how we cope with illness. And so that with this, for example, with this last little picture, this is a young girl who's in our cancer center getting chemotherapy, but you would never know other than her head, that she was having chemotherapy. Really what she's there, she's being a 3-year-old, you know, and she's carrying the load of her illness by playing with a music therapist, by living life, and trying to manage illness as best as she can. Thank you.
Thank you. Thank you very much, Katie. What we're going to do now is we're going to try to get you guys to lunch as quickly as we can, and so we'll hold that panel discussion until after lunch, but Dr. Blinderman is going to go through some of the pain questions now. And I'd like to introduce him. This is Dr. Craig Blinderman. He's the co-director of the MGH Cancer Pain Clinic. He's also in the palliative care service at the Massachusetts General Hospital.
Great. Can everybody hear me? It's working, more or less? Okay, great. So, you know, people only remember about 10 or 15% of what's in slides anyway, so it's pointless for me to go through a bunch of slides that you already have in your packet. And what's really important anyway is for your questions to be asked and to be answered. How about I'll move this up a tiny bit? Better? Yes. Okay. So I'm a pain specialist. I work mostly with patients with cancer-related pain. I also see chronic pain patients as well. And I'm here to, the title of today is Ask the Expert. So ask me whatever's on your mind. I have about 5 questions here that I'm happy to go through, but if there are things that are burning that people want to talk about, feel free. What are you guys concerned about? What would you like me to speak about today?
What's the most effective way to deal with pain from your bones?
Okay, great. So bone-related pain. So that's a great question. So it's very common, right, among patients with neuroendocrine tumors that have metastasized to the bone. It's a very common place to metastasize. Very painful. The bone has a lot of structures that can cause pain. The outside of the bone is a somatic structure. That'll cause pain. The inside of the bone is lined with a lot of nerves as well. That can cause pain. So it can be a very difficult pain syndrome for a lot of people. So the mainstay of therapy for severe pain is actually opioid therapy. So these are strong pain medications, morphine, oxycodone, et cetera. Then we also consider a whole other category of pain medications. And I'll put up one slide. It's probably the only slide you really need to pay any attention to. And it may be helpful to answer this question as well. So we think about what's called adjuvant analgesics. Now, adjuvant analgesics are basically, it's a misnomer, but these are medications that were designed for other things, right? An anticonvulsant was designed for treatment of seizures, but people have found that they actually have a role in managing neuropathic pain, for example. So this class of what's called adjuvant analgesics are a bunch of medications that we found actually has pain-relieving effects as well as their primary role for whatever they may have been originally designed for. Among bone pain, what's particularly helpful are actually anti-inflammatory medications. So these are medications like NSAIDs, right, that people are very familiar with. A lot of them are available over the counter. The reason why NSAIDs, or anti-inflammatory medications, are so helpful for bone pain is that we know that there's a lot of inflammatory mediators that are active whenever there's bone metastases. In fact, a lot of people who are doing research right now in bone-related pain are looking precisely at some of those receptors, precisely at some of those factors, and are trying to target those specifically. For example, bradykinin is a small molecule that we know is very much involved in propagating an inflammatory response, especially in people with bone-related pain. So if we can find a bradykinin antagonist, that might be a very directed type of therapy, similar to what you hear about in cancer-related therapy. We're trying to direct things right at the site of a receptor that we think is potentially responsible. So there's a lot of research going on in that, but we don't have directed therapies right now. What we do have is this class of medications called NSAIDs, or anti-inflammatory medications. They're particularly helpful for bone-related pain. Another type of medication that can be helpful are steroids, and that's in that category of others under adjuvant analgesics. So steroids, which people hear about all the bad side effects of steroids, actually can have a lot of important pain-relieving effects, especially bone pain, especially at this time of the initial injury, until you're able to either titrate up strong pain medications or find other directed therapies towards the bone pain, and to initially decrease a lot of that inflammation, decrease a lot of that pain right off the bat. I tend to use steroids a lot, especially when patients are in acute pain related to either bone or even neurological types of pain. So that's another class of medications. Then there are the bisphosphonates. Now, bisphosphonates, as you heard about earlier, are medications to help strengthen the bone in general. We use them generally for osteoporosis. But we've actually found that among patients with cancer and bone metastases, bisphosphonates can actually have an analgesic effect. They actually can help with decreasing pain. How significantly? Well, significantly enough that it actually has that as it's recommended to do so as an adjuvant medication. And it also helps with decreasing what's called skeletal-related events. These are fractures or other kinds of immobility that may occur as a result of having bone metastases. But from my mind, they're primarily, their use should be for the help of relieving pain and dysfunction around bone metastases. So those are some of the pharmacological modalities that one would consider for bone-related pain in that category of adjuvant analgesics. And in the non-opioid analgesics is NSAIDs. Then there's a whole group of other types of treatments that we think about, like radiation, for example. Radiation therapists can oftentimes radiate specific aspects of the bone, and whether or not the tumor is responsive or not, they may have an incredible amount of pain relief associated with that. Surgical interventions are also sometimes used, especially when there's nerve involvement or there's a potential for neurological problems. And then lastly, another interventional approach that could be used, and that's on this other side of the column there, are vertebroplasty. And this is something that interventional radiologists would do, where they go in to a bone that, for example, has had a lot of metastases and has fractured, and the vertebrae, which is normally this high, is now this high. So you can imagine the problem that people would suffer from that, both in terms of back pain, functioning, neurological problems, and so on, because nerves are being compressed. And what they do is they go in initially with a balloon, blow it up a little bit, and then add a type of cement into the bone to reinstate the height of the vertebral body, and that both helps with pain and helps with improving functioning, and it's a very effective therapy. We use that a lot, especially when there's compression fractures. So those are the general approaches. There's the pharmacological approaches, opioids, NSAIDs, steroids, bisphosphonates, and then there are interventional approaches that you could use as well, interventional radiology, radiation therapy when appropriate, and surgery if needed. Other questions? I know people always worry about getting addicted with pain medications. Is that a concern to people? Do people worry about that? Addiction, what is that all about? Did I see another hand up here? Yeah? Stops the pain, right? It's amazing that this is a whole new area of research. We heard some of it already from Katie and from Robin, talking about how there's whole holistic approaches and other wellness approaches that we use in general, but we also know that it actually can specifically help with pain. Now, how does that work? Well, here I'll just point you to the other slide that I think maybe there's two slides that are useful. The rest you can use as, I don't know, scrap paper. My daughter likes to write on things, and I give her all of my old papers that I don't read anymore, and she can write all over them. So you can see in this example, when they say it's all in your head, well, it is all in your head. Pain ultimately is all in your head. How else would we experience pain if we didn't have this thing up here, this brain? If one solution to everybody's to pain would be to chop off your head. You would not have pain anymore. It would be gone. So ultimately, pain ends in the brain, in our center, right?